Hello, everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, a board certified rheumatologist and an obesity medicine specialist. Today, I am discussing with you a case that I saw earlier today, and it has some learning points that I would like to share with you. First of all, this patient is a young 32-year-old male who had initially presented to me with evaluation for weight loss. On detailed history, I found out that my patient mother had um, thyroid cancer, medullary thyroid cancer, and as you know, the GLP medications are contraindicated in patients who have personal or family history of thyroid cancer. So I talked to her. It was a very hard decision for him to let go of pursuing this GLP medications because of the fact that we know how effective they are. But in this case, I would like to discuss with you what treatment option I tailored for this medication for this patient and what medications I chose. By the way, if you are new to my channel, I talk about autoimmunity and obesity and inflammation. And my goal is to provide tips for longevity and vitality of your health. So just subscribe to this channel if you like it, share it with someone so that I feel like getting a feedback from you guys that this effort that I'm putting in for public education at no cost to you is helpful and I can continue to find time for this. So in this case, we'll be talking about a 32-year-old male who has obesity, who has been on a BMI range of between 31 to 32 for several years, who initially came to me for evaluation for weight loss treatment and wanted to get a medication, either Wegovy or Zepbound, but we found out about his mother's history and we decided not to proceed with it. And what actions did we take? Well, in this video, I'm going to go back into the initial visit and the second visit was to actually discuss about the medication called Contrave. Contrave, I have used it for several years to control appetite, craving, and it is not as strong as it is when you compare with GLP medication. But in this case, since I could not use a GLP medication, this was a great option. Contrave is a combination medication with naltrexone and Wellbutrin, and this medication works well in most of my patients. Somehow it works well with men, but I don't think that it is something that one should just use it only for men. But in my personal experience, I think the tolerance of the medication is great for them. So I started working with him on weight loss about 3 months ago, and he has lost about 10 pounds, actually 8 pounds, which is not a lot of weight, but it is enough for me to say that I am seeing positive results. Now, I have to add that during this period, I also found out that he was insulin resistant with high insulin levels and hyperglycemia. On his second visit, I added metformin, 500 milligrams. Now, so using Contrave for weight loss and appetite control is one step. Number two step was adding metformin because its impact on insulin resistance and how we can manage these two medications together. Well, I discussed with him about how metformin works, decreases insulin resistance, increase metabolism of glucose consumption, and also helps with uh, overall, if you have less and less glucose circulating in your blood, you have less damage to internal organs. So it was initially also studied as a drug for longevity as well, which now GLP medications have taken over that role, and now they're going to be used more and more for longevity and vitality, for reducing the glucose load and damage to cells of the body if you run into high glucose levels all the time. So Contrave worked good for him. He had improvement in his cravings, and he has stopped snacking. He is working on improving his diet and lifestyle with better choices of high protein diet, and metformin had started also helping him, but today he told me that metformin is causing him headaches. Now, this is a commonly prescribed medications, and we do see patients from variety of walks of life and having different side effects. So metformin, um, is it causing headaches? Is it because he's having some other issue? We're not sure. So at this time, we are going to claim that the medication may be causing some problem, metformin, because he actually had headaches, but the headaches became more pronounced while he is on metformin. I do have to say that I have given him advice to take B12 while I started him on metformin, because metformin is important medication. We use it a lot, but it also causes B12 deficiency. A lot of people don't know about it. So he's been taking B12 as well. In any case, since his headaches have been getting worse, I suggested that we hold off on metformin. Now, metformin was helping him with insulin resistance. Obviously, it is a great drug, and I had to think about what else could I do for him to improve his weight loss and his metabolic. And I thought that maybe adding a medication such as Topamax or topiramate might be a good addition here. Now, he has reported almost daily headaches, which have gone worse. And people with migraines, we use topiramate or Topamax for prevention of headaches as well. And this has also been postulated as a weight loss medication. It is combined with uh, phentermine in a medication called Kismia, which is an oral agent. It's a controlled substance. And I recommended that we use Topamax. Now, um, the reason I am not going for Kismia is because he's a telemedicine patient for me, and I do not prescribe controlled substances on telemedicine. But if he was seeing me in person, that could be another way that I could give him Kismia. But at this time, I gave topiramate, making this as a switch between the metformin and Topamax. I do not like to use Topamax and metformin together because of the potential for some side effects. So right now, my approach was to start him on a low dose of Topamax, 25 milligram for a week and 50 milligrams. And based on his response, I would reevaluate him in 4 weeks and see how he's doing. But at the point, what I'm trying to make is that we will discontinue metformin, we will add Topamax, and he's already on Contrave. I think I mentioned earlier, Contrave had been helping him. He's on the full dose, which is 2 milligrams twice a day of metformin, and he's been happy with it too. So I also reinforce the fact to continue high protein diet, strength training 3 to 4 days a week, cardio 2 days a week, and also making sure he's in consuming probiotics for better gut health. So I think this was the summary that I wanted to share with you. It's an interesting case where we started with different variety of choices of medications, but the most important thing is he checks in with me. He's working on his lifestyle. That would be the best thing for him going forward, in addition to medications. So if you found this useful, please like it, subscribe it, share it with someone, and take care of your health. And I will see you in the next video.